Political leadership is not separate from nursing. It is nursing at scale. It is population level assessment, and it is really systems-based triage. And of course, it's prevention codified into law. We understand that continuity of care and governance is continuity of care for our society. So the question is no longer whether nurses belong in politics. The question is whether healthcare can afford for us to stay out of it. I am really honored to moderate this critical conversation with Dr. Marian Leary, and we're joined here by an exceptional panel. We have Representative Tarek Khan, we have Dr. Courtney Niange, Dr. Justin Gill, Dr. Nancy Mannion, and Dr. Kimmy Ellison. We'll have them introduce themselves, but I'll hand it over to Marion for now.
Yeah, thanks, Gloria. I am really excited for tonight's discussion, which is going to focus, like Gloria said, on a number of different things, focused around governance and structural influence. We're going to talk about what changes when nurses hold elective office, and I would argue everything changes, right? And we have an incredible group of panelists who are going to talk to you about their experiences holding office, running for office, and what that all means, how nursing training shapes policy, what barriers keep nurses out of political power, and how nurses move from interest to action. So before we get into all that, let's have some introductions. So Gloria, do you want to kick off our introductions?
Yes, thank you. So we really are honored by the nurse leaders who have stepped directly into political and that governance space. I'll invite each of our panelists to briefly share three things. The first is your clinical background, what sparked your political involvement, and then what your very first step was into political work. What did that look like? So I will hand it over to first Representative Tarek Khan.
Thanks so much. Hey, everybody. Great to see you all. So I apologize. I'm on the floor with my dog right now. And I just got back from a long session in Harrisburg. I'm on the Appropriations Committee. So we have hearings and so like literally just got home. So I started off as a floor nurse, and what first got me, I think, was I was in the patient room, and I was actually changing the patient, and 60 Minutes was on, and Ed Briley was interviewing this person who was running for president. And he asked him a question about why will the Black community support you, or how do you explain that Hillary Clinton right now is winning the Black community, and you're at like 5%. And sometimes when you're listening to interviews, you think, well, what would I say? And Barack Obama said, I actually want to say the Black community is not a monolith, and they have to earn my trust. They're not going to just see a Black guy and say, that's my guy. And I just something about that honest response that he gave just kind of made me take notice. And I just really, I did some research on the guy, and I really connected with him. The main thing was he was talking about his mother who died of cancer, and while she was dying, she was fighting with the insurance company over health insurance. And that really resonated with me. And so that was the first campaign that I actually knocked doors on. And I really fell in love with this guy who promised to improve our healthcare system. And sure enough, the first major bill that they passed, it wasn't the first bill, but the major bill was the Affordable Care Act. And so that was my first involvement in it. And during that whole time, I met a really interesting state rep. It was one of the first times that I did lobbying through the Pennsylvania State Nurses Association. And that, sure enough, that was Josh Shapiro, State Representative Josh Shapiro. who had just endorsed Barack Obama, was the first Pennsylvania legislator to do so. So that was sort of my first kind of involvement. And just knowing, knowing the time and knowing there's other panelists, I'll just short circuit it to say what really made me get involved in politics was Hahnemann. A hospital had been around for 171 years, bought up by a for-profit corporation, private equity backed, and within 18 months, all of their union nurses had been fired. The hospital was shut down. And it was after the hospital had invested, the private equity had invested nothing into that hospital, and feeling like our elected officials should have done something to prevent that. And so safe staffing was another thing. I helped write that as a PSNA vice president, Pennsylvania State Nurses Association vice president. And then I became the president. It was our number one issue. We actually helped the American Nurses Association change their position. We've changed our position as a state organization. American Nurses Association changed their position after we went on with safe staffing standards. And my rep, the current rep who was representing our district, was not for the Patient Safety Act, and it was another reason why I decided to run. And rest was kind of history. We won against a 12-year incumbent in a 20-point landslide with a coalition of unions and working people and taking no corporate PAC money. So, thanks.
Thank you. Next, we'll hear from Dr. Courtney Nyange.
Yes, good evening, everyone, and thank you all so much for being here. And I'm very thankful for this opportunity to speak with you all tonight. So I'll jump right into the three questions. So the first one is clinical background. So my clinical background is actually in neonatal nursing. Started out as a nurse resident and got into my dream area in the NICU. Did that for a couple of years and then transitioned into academia. And so I have been in nursing education now since 2013. And I think what actually sparked my political involvement would have to be when I stepped into a higher up leadership role in my institution and became more aware of policies that were or bills that were starting to be introduced in the legislative sessions and stuff regarding kind of the rollbacks of diversity, equity, and inclusion initiatives, not wanting individuals to engage in any implicit bias training, so things like that. So that was in 2023, actually, kind of when it first, I was like, oh, these are things that are really going to impact us here in higher education. So that's when I just started paying more attention. I think it's like, when things aren't impacting you, you don't necessarily pay a lot of attention until it kind of shows up at your doorstep. And so hopefully all of you all who are listening will start getting involved sooner and, so that we aren't in this position again where we're just trying to fix things and it's showing up. So that really just sparked my involvement in just, again, paying attention. And then really my first step into political work, I would say started also in 2023 when I ran and was elected to become the director of practice for the Tennessee Nurses Association. And just the proximity with working with the Government Affairs Committee really just started opening my eyes up. And we started taking our students at my institution to TNA Day on the Hill, got inside the chambers, and I was like, oh, yeah, this is where things happen, and I was like, I want to be involved in this. I want to be able to start making decisions that are good for people. So yeah, and then I followed that up with another Day on the Hill, and then actually went to DC for Day on the Hill and had a chance to actually advocate for a policy for us. I don't know if you guys are aware, but if you have ever been the recipient of any of the Nurse Corps loan repayment programs, you do know that we're double taxed. And so I was able to share my story of receiving those loan repayment programs, but being double taxed and being put in a whole different tax bracket and ending up owing the IRS money. So seems like things that are beneficial to us have all kind of other things underneath them that are not so beneficial. And I'm happy to say that legislation was introduced, the Nurse Corps Tax Parity Act, the next year. So I just, hands-on in it, just really, it felt good to advocate for us and what we need to help us. And so, yeah, now I'm in it and running for office myself.
Thank you. Thank you for sharing. We will definitely touch more on that. And everybody that wants to get involved, of course, you're all invited. And I hope to see you on May 7th in DC. Next, we're going to hear from Dr. Justin Gill. Justin?
Thank you so much, and welcome everyone. Thank you for joining. I'm Justin Gill. I am the president of the Washington State Nurses Association and work clinically as a urgent care nurse practitioner in Everett, Washington. Everett's about, let's say, 30 minutes north of Seattle. Um, I'm joining you all not currently as a declared candidate, but someone who really does understand, or at least have been exposed to a situation in Washington where we have once had, up to 9 nurse legislators in our state House and state Senate, and currently we do not have any. Um, and it's really interesting because you can look at the progress that we've made as a state on nursing issues when those nurses were in office, and some of the big leaps that we've made on everything from advanced practice to, meals and rest breaks. And now, when we don't have that direct voice, what does that mean as far as us being able to carry our message forward? For me, when I graduated high school, I originally was interested in being involved in going to law school, being involved in political science. But then, really, during the 2008 recession, while I was interning for my local congressman in California, was exposed to, the some of the issues that people faced, when it came to Medicare, Medicaid, healthcare access, health insurance disparities. So that was something that really kind of reminded me of, my ability to make a difference as a healthcare provider, as a nurse. My sister was in nursing school at the time. I expressed some interest in going into that. Um, and throughout nursing school and in my journey, when I was initially licensed as a registered nurse, I joined my professional association. And in Washington State, our professional association is also a union, Washington State Nurses Association. Um, and I immediately, had an opportunity to join our Legislative and Health Policy Council, go through some of the bills that were going through the legislature, and really be able to look at some of the issues I was facing at the bedside and be able to connect that with some of the bills that were going around. Um, and that really, sparked my interest in how I can blend the passion for nursing and health policy. Served on the ANA Political Action Committee for a short while, and recently attended the Healing Politics campaign school, which is a campaign school that's geared for nurses, to be able to tap into their talents and really remind them of how they really possess the skills to be political candidates for the future. So right now, my goal is to get more nurses involved in running for office. How I can help support them, and how our state association can help support them in that specific journey. And I think for all of us that are interested, while it may not be right for us right now, look at the opportunities that come up in the future and never close that door moving forward. Um, and I'll leave it at that.
Thank you. Thank you, Justin. I think we have several alumni here. Of course, we were in a cohort with Justin, Marion and I, and also Dr. Nancy Mannion. So I'll hand it over to you next. But yes, please, if you're running for office, please reach out so that we can support you and you can have, the nursing workforce behind you. Dr. Mannion?
You're on mute, Nancy.
Hi, everybody. Thanks for joining us tonight. I think this is going to be a really eye-opening experience for those of you who are thinking, like, what can a nurse do, in terms of being involved in a political way. And so, yes, there are four of us who are alumni from the cohort of Healing Politics that happened back in August. And we do highly recommend. It's a great experience, a wonderful opportunity to really understand what politics is about and how nurses can use their voice. So my background is as an emergency nurse. I have practiced in the emergency nursing environment for most of my clinical career, from a variety of roles, from the bedside to actually the boardroom. And I mean that from working as a clinical nurse, a nurse administrator, department head, but also because of my involvement in the Emergency Nurses Association, where I served on the ENA Board of Directors and served in 2006 as the national president. During that time, when I was president of ENA, the Institute of Medicine released a report about the status of emergency care in the country. And I had the privilege of being able to testify in front of Congress, a Senate committee regarding that report, along with colleagues from ACEP and other emergency medicine organizations. So that, was an interesting and inspiring time to think that, the focus of our country was really on that. And of course, it becomes very focused on emergency care when tragedies like 9/11 happen and other types of events, COVID. The emergency department really, to me, is like this very thin veil between the community and the healthcare system. And so I've always had that understanding and appreciation for what's going on in the community is really, impacting what's happening in the healthcare system because we're really that pivot point between it. In other work that I've done, I'm currently serving as chair of the Nurses on Boards Coalition. Our mission is to improve the health of communities through the service of nurses on boards. And I don't mean just in organizations like the Emergency Nursing Association or the ANA, but in things like United Way, the Pop Warner football in your community, local food banks, organizations that are outside the scope per se of healthcare, but where nursing can be very influential. And we have placed over 11,000 nurses across the United States into board seats. And we know there are even more nurses that, beyond that number who are currently serving in board positions. And that's very powerful because, and when we get to the discussion about how does nursing fit into the scheme of politics and power, I have a few thoughts about that specifically. But my political involvement really was my involvement in nursing has really been around leadership and governance. I have not really been what anybody would call a political person, other than that I always execute my constitutional right to vote. I have volunteered to help at polling places during political event, during elections. But I never positioned myself or visioned myself as stepping into that political arena until this spring. And if you think back to the things that were swirling around, it was the beginning of the second term of current president, and there was a lot of discussion about types of cuts that were going to happen and what this new budget bill that was going to come out in the summer was going to look like. And so there was a local group that was sponsoring an event in my community, and they were looking for speakers and about healthcare and science and teachers and I thought, well, I know a few things about healthcare and I'm certainly comfortable speaking in front of crowds. So I offered to address the group with some concerns about what the budget cuts were going to look like. So I did. And there were several hundred people at that event, and I was approached by the local Democratic Party, and said, "We think you should run." And I said, "Run for what?" And they're like, "We think you should run for Congress." And I'm like, "I've never even run for a school board." So, really, you're asking a lot here. But the more I thought about it, for me, nothing like jumping into the deep end. But that's not that's not unusual for me. That's, I think, some of it may just be because I'm an emergency nurse and that risk taking is just part and parcel of how we think. But I also felt like if not now, when? And if not me, who? We have, the person that I'm running against was the architect of that budget bill. And I know the kind of harm that that bill was going to create and is creating. And I thought, I cannot let this continue to go on. I mean, somebody has to stand up and speak out. And I think nurses are so ideally positioned. We are advocates every single day in the work that we do for our patients. And if you just think of America as your patient, then nurses need to stand up and speak out. And so I am a declared candidate. I was endorsed by my county last evening at our endorsement convention as the Democratic candidate for Pennsylvania's 11th congressional district. And the reason, there's a lot of reasons for this, but I will say this, right now there is one other nurse sitting in Congress with a similar point of view of mine, and she needs company. And I think America is in critical condition and it needs a nurse to be able to bring healing to America. And that's what I intend to do. So that's how I got involved, and I'm all on it.
Thank you. Thank you, Dr. Mannion. If not now, when? So again, we'll see you in DC on May 7th. And finally, Dr. Kimmy Ellison, if you could please share your journey.
Hi, everyone. Thanks for having me. My name's Kimmy Ellison. I am in Austin, Texas right now. I did not have a very straight path into nursing. I have a degree in government. I graduated from the University of Texas in Austin back in 2000. And as part of my degree, I needed an internship. And at the time, I grew up in a very conservative family. Republican politics was all I knew. And I wound up being an intern on the George W. Bush presidential campaign. And I ultimately wound up working in the White House for Karl Rove. And I saw everyone else that was 1 and 2 steps ahead of me in their professional careers. And I thought to myself, when I'm 80 years old, if I stay on this trajectory and I wind up being a lobbyist for Philip Morris or Big Pharma, am I going to feel proud of the life that I led? And I thought there's a good chance I won't. So I took a complete leap, and I may be the only person in the history of the United States to go into the Oval Office and tell the President of the United States that I was leaving to become a nurse. And there was a lot, you're going to become a nurse? Why just a nurse? And I thought to myself, when someone you love is in the hospital, clearly the most important person in that hospital is the person that you love. But who is the second most important person in that hospital? It is the nurse that has eyes on the person that you love. So becoming a nurse was the best decision of my life. I came back to Austin and I did one of the early alternate entry programs, got a master's degree in 2008. And a few months after that, I joined the Peace Corps. I lived in West Africa for a couple of years. I was in a small village in northern Ghana, predominantly Muslim village. It was a wonderful experience. And I worked with a midwife there. My second year of service, I taught at the University for Development Studies. I taught first year anatomy and physiology to nursing students. After that, I relocated. It was so hot in northern Ghana. I thought I want to be really cold. So I moved to Chicago, where it was really cold. I worked as an ICU nurse at University of Chicago. I did a little bit of HEMONC, and then I transferred to CTICU. I worked nights while I got my DNP at Rush University. I took my NP boards, and I came back to Texas, which is my home. And I've been working in nonprofit healthcare ever since. I've been working in some capacity with women that have breast cancer since I started off as an NP. In 2020, as fate would have it, you play the numbers, it's really not that random. I was diagnosed with very early stage breast cancer. This was the middle of the pandemic. My treatment was extremely straightforward because, well, it was a little nuanced because we were in the middle of a pandemic and I didn't know if radiation therapy was going to be readily available, because whether or not things were going to be open or not open. But in general, my disease was caught very early. My treatment was straightforward. I am just fine today. And about a year after that, I was promoted to be the clinical director for the breast program at the facility where I now work. There was no nationally accredited breast program in Travis County. I led that effort. And now pretty much all I do is I still see patients in clinic. And
Sullivan? What?
Kimmy, you're muted. You got put on mute when everybody else got muted.
Oh.
Sorry about that.
Oh, what was the last thing y'all heard me say?
You were promoted to director of the.
Yes, thank you. Clinical director of the breast program. We were not NAPBC accredited at the time. There was no accredited breast program in Travis County. I led that effort. And we are the only place where you can go in Travis County and the surrounding counties if you are diagnosed with breast cancer and you don't have insurance. And I don't know if y'all have heard about Texas and what's going on down here with our healthcare systems, but we are one of 10 states that have not expanded Medicaid. We have more people without insurance than any other state in the United States. And I can tell you firsthand, people are dying. I am in rooms with patients. I have names and faces of women who have died because the system is rigged. The wheels started coming off for me a couple years ago with the Dobbs decision. That started down here in Texas. And then last year, our governor issued an executive order saying that people approaching hospital systems had to announce whether or not they were here legally or illegally. I provide care to a lot of people who are not from Texas. I don't ask them where they were born because I do not care. I care about their pathology report and I care about how fast we can get chemotherapy in their veins. So when my state representative, Gina Hinojosa, announced that she was running for governor, people in Texas sit in these House seats for very long periods of time. She was in the seat for 10 years. Her predecessor was in the seat for a quarter of a century. And I thought, it is now or never. I did the new politics training over the summer. That is a political training for people with a service background, military, Peace Corps. That was very helpful. I thought maybe I would run in 2028. I did not have campaign infrastructure set up. I took a complete leap, just like I did back in 2004 when I decided to become a nurse. I took a complete leap, and now I am in the most competitive Democratic primary in the state of Texas. Early voting ends tomorrow. Primary election day is Tuesday. I'm the only person in this race working full time while campaigning, which is insane. But people in Texas know we need Medicaid expansion. Win or lose, I will not stop talking about this. As long as I have air in my lungs, I will make sure that Medicaid gets expanded in this state. So that's me.
Thank you. Thank you so much, Dr. Ellison, and everyone for sharing your leadership journey and for stepping into spaces where nursing voices are urgently needed. Let's move into our roundtable discussion. I'll hand it over to Marian, Dr. Leary.
Sure. Thanks, Gloria. And I hope you all are just starting to become inspired by all of the background and all of the things that our nurse panelists are doing, as they're also, like Kimmy said, running for office while working full time. Like, this is what nurses do. And this is why we need nurses running for office, holding office, and also working on campaigns. We are a multifaceted group of individuals. All right, so Representative Khan, can you talk about what changes when nurses not simply testify on legislation, but upstream when we start drafting and voting on legislation? How does our clinical expertise give this type of different types of legislation more power, more experience, more authority?
That's a great question. You're talking about from the outside or from the position of a legislator, or both?
Yes, as a position from your position as a legislator and your background as a nurse, your lens as a nurse, what do you bring to that process?
I think the perspective of a nurse brings an incredible amount. Anyone really from a healthcare standpoint, I mean, you get brownie points if you're an X-ray tech and testifying. Brian Cutler, who was the former leader of the Speaker of the Pennsylvania House of Representatives, was an X-ray tech, and he would constantly talk about his experience in healthcare. Who has more experience, even more than a physician, with the healthcare system than the nurses? So it's an incredible position of, I would say, that the perspective of a nurse is unrivaled, and there's a lot of respect that comes with it from your colleagues, from the public. I'll give you an example. Today, I'm on the Appropriations Committee, and we had the Department of Corrections testify. Okay, Pennsylvania, and there is a $5 copay for inmates to access healthcare. All right, doesn't sound like a lot. The average inmate makes 23 cents an hour. So if there is an emerging health issue, the inmate has to consider whether they're going to spend a half a week or more of their pay just to access medical care. And the Department of Corrections did not see this as a problem. They didn't see this as something that was delaying access to care. For them, it just meant that less patients were requesting to see their providers, and that allowed them to provide the adequate amount of care that they could actually provide. So my position as a nurse, I was actually writing this bill tonight that we're going to cap the fees to $1 for inmates, which sounds like not a lot, but again, that's like 4 hours of work for someone, which is still a lot, but it's better than $5 an hour. It is an immense level of respect as a healthcare provider. So I'm a doctor. We got our PhD together right at Penn. I'm a nurse practitioner. That is an extraordinary amount of gravitas. Being a nurse, being a RN, even being an LPN, adds levity, adds gravity to any position. And it really gives you a good perspective of things. I think our unrivaled work ethic is a huge asset. The other legislators, I think, remarked that wow, like these nurses, like, so the other nurse, the other RN, is also in appropriations, which is like the committee that's like it's like the best committee to be on, right? Because you get to see every single bill, you get to be as part of the budget. The other RN is on appropriations, so it's what we do a lot. We multitask. We work hard. And so, but most importantly, all those things, like I was just so inspired hearing Nancy's story, because that's exactly what, like that's on par for what nurses bring to when they run for office, and the expertise that they bring, extremely important, and they get it. They understand the reality. And that's in the end what we're here for. We're here for common sense and really fighting for our founding principles of life, liberty, and the pursuit of happiness, life, right? Health and safety. It's what we do. It's what we know best. So it is an incredible opportunity when you have a nurse that is working on legislation. There's the respect that comes from it. There's the knowledge that comes for it. There's the passion and advocacy that allows you to really be a force in bringing change.
Derek, I'm sorry, I want a follow-up question. You sort of alluded to this, but do your other colleagues, do they know that you're a nurse and look to you for specific health-related policy questions or legislation? Like, how are you viewed by others in elected office?
Yeah, absolutely. I think when I speak, it was one of the reasons why we had all but 2 Democrats vote for the Patient Safety Act, the bill that I helped write as president of the Nurses Association. Even though the hospital association was super against it. I mean, they basically trained their fire on us, and we were able to get all but 2 Democrats. One was a physician. One was in like a very, very, very red seat, and just I think it's just getting bad advice. And we got probably 12.5 Republicans on the bill as well. So it was helpful for me to with those votes and immediately shoot down the bullshit arguments of why nurses shouldn't be safely staffed. So that's one thing, just among the colleagues. You never want to be the smartest person in the room, and so I'm not constantly having to say I'm a nurse because that gets old. We have another person that says what position they are, and believe me, colleagues are kind of sick of hearing it. So people know I'm a nurse, and they know when I speak that I'm speaking from the position of someone who still works as a nurse. So this is the end of my 12-hour shift. I got to work this morning at 9 o'clock in Harrisburg on appropriations. Just like many of you, this is like the end of my shift. Tomorrow, I go to work at the health center at 8:30 in the morning, seeing patients. So it's what we do, right? It's what we do as nurses. It is that the nurses have families. They're going to school. They have clinical work. Being active in the in the legislative sphere is no different from the work. Remember, when you take the oath, it is to advocate for the welfare of our patients. It doesn't say at the bedside. It's advocating. So whether that is at the bedside, whether it's telling physicians, you're not leaving until you address this patient's pain, or you're not continuing the surgery until we address my concerns. Either it's that, or it's in the legislative sphere where you're actually saying, this is bad for patients. I'm going to make a stink because that's what we do when things aren't right. We call a timeout and we stop things. That's what we do. So it's no different being a nurse, being a legislator. There's a lot of overlap there.
Thank you. Thank you, Representative Khan. Dr. Gill, I'd like to look at now your state level involvement. How does nursing systems influence workforce legislation and the scope of practice policy? And then where do you think our blind spots appear when the nurses are absent from those decision-making tables?
I think for the first part of that question, when it comes to workforce, I think the biggest question right now is really looking at how do we retain the workforce in their roles, right? And that directly relates to staffing legislation. That directly relates to legislation that impacts social determinants of health for the patients that we see. Uh, I think that when it comes to being able to connect those issues, it makes a lot more sense when you explain that to say when I was teaching students or talking with other nurses, because I think when you talk about, say, politics or political advocacy just in general, uh, people don't necessarily feel that connection. But say when you connect a piece of legislation to your shift or your staffing committee in your hospital, you can tie that back into a piece of legislation that was led by nurses. Now, whether that was, led by a nurse in the legislature or outside of the legislature, nurses are the ones that led that discussion. But also not being naive to the fact that there are other players in this realm, right? There are hospitals, there are insurance companies, there are for-profit corporations, private equity groups, physicians, other allied health professionals that we work closely with. And how do we tie all of those pieces in when we develop a strategy? Um, so, I think I see legislative advocacy and actually our ability to be in these roles of making decisions as a part of our professional practice. I see the advocacy piece and then the nursing role as being really kind of synergistic because they really play well together. Um, in our state alone, we've seen legislation advance on safe staffing, adding more teeth to the law on staffing committees, but that still is not solving the issue for many nurses in various facilities in our state. We, in the past, became very close to passing staffing ratios and joining a couple of other states that have already done the same. We, have made huge gains on full practice authority. We've been a full practice authority state for advanced practice nurses since I believe 2004. But there's been issues where, we've tried to advance legislation, say reimbursement parity for nurse practitioners that bill private insurance for commercial insurance payers. And we've come close, but not having that nurse in the legislature to help kind of discuss what this is about, and trying to, I think, counter the narrative from that of insurance companies, physician groups, and those other groups. It proves very difficult, and I think it highlights the reason why we need nurses in those positions, not just to advocate for us, but to give that perspective in those back rooms where, a party or a specific group may be caucusing privately, that makes a huge difference. Blind spots, I think the other piece with this is there are other pieces of legislation that may be led by other groups that oftentimes we as a nursing association don't necessarily lead with, but they directly or indirectly impact nursing. Um, and if we're not looking at other legislation from other groups or other interest groups, that can directly affect our practice. And if we don't have nurses involved at every level, both inside the legislature and outside the legislature, those things can pass, and we're not necessarily playing an active role in them. Um, so all in all, again, I go back to when we had nurses in our state legislature. We saw significant movement forward on so many of these issues. And now that we don't, that doesn't mean that we don't have allies. But having that understanding, that nursing perspective, it does carry some value in your ability to carry an issue forward when there's thousands of other bills going through at the same time. So I think that's looking at it from a workforce first perspective. That would be my best piece of recollection. I also would say that the other piece is when we see legislators talking about, say, the nursing shortage, there's a narrative that goes around from our state legislators of what can we do to produce more nurses, where we are trying to promote a narrative of what can we do to retain nurses in their roles. Because we do have a shortage, but it's a shortage of nurses that are not willing to stay in the positions that they're in and in the conditions that they're in. And there are other groups that help push the narrative of needing to train more nurses, which, yes, we need to continue focusing on our future. Um, but if we don't have nurses speaking up on that and telling their stories about why it is that we have open positions, we essentially leave those talking points to the groups that may not be on our side on those issues.
Thank you. And a follow-up question is, because I know you've been really successful with sharing that narrative, if you could just touch on that.
Yeah, the narrative of nursing shortage. Yeah,
Yeah.
I think all of us can connect back to it, right? How many of us have been dealing with moral injury from the systems that really kind of affect the work that we do when really we do want to do the best for our patients. If you're giving a nurse that really should be having, say, 4-to-1 ratios, a 6 to 7 to 1 patient ratio, do you really think they're going to maintain themselves in that role without wanting to leave that position? Nurses are human beings. They're not folks that can be taken advantage of. They have families. They have lives. They have children. They have spouses. I think that when we look at this just practically, we really have to understand that piece. And again, we're not gonna train our way out of shortages in facilities. We can do better for our patients when we actually listen to nurses, look at their needs, invest in them, which requires investing in them staying in their roles, and being able to mentor the future profession. I remember when I first started as a nurse, I barely got through my first 6 to 9 months, and I was already being asked to be, serve as a charge nurse, which really blew my mind that we were already at that point where I had a certain amount of seniority because we had burned through so many nurses. And so, again, we're not a commodity. We are, I think, when we invest in our nurses and don't treat us like a commodity that you can just replace, that's when we see outcomes improve, and that's when we see a better healthcare system for everyone.
Thank you, Justin. Marion?
Great. All right. So Dr. Nyonge, can you talk a little bit about how academic leadership intersects with workforce policy at both the state and federal level?
Yeah, absolutely. So when thinking about workforce policy, I know, Justin, you were mentioning that, there's not a shortage of nurses per se, but of nurses who want to stay right in the profession and in the environments that they're in. Well, for us, on the academic side, we are definitely challenged with how do we get more nurses out here into the workforce? And so it's a unique opportunity for us to partner with some of our state agencies. So, for instance, there's been so much good work going on in Tennessee with the Tennessee Hospital Association and many of our academic institutions. And we have now worked together to put out a nursing apprenticeship program. And so, just developments like that are really key. And we have the knowledge in the academic space to understand like what does it take to get the nurses out there, but we also need that clinical partnership with the hospitals because we need to know exactly what do the students and the nurses need to be able to do when they actually graduate and when they start working with you all. So the intersection there is clear. We need each other. We have to work together to get these things done. And at the federal level, I mean, I know there's lots of initiatives that there's funding through Title VIII programs and all of that for nurses and individuals to become nursing faculty because we also know we need nursing faculty to teach nurses, right? So there's just so many things that connect together. And we have to be the ones to talk about this and advocate for this together in conjunction with our, state agencies and the federal government and all of those agencies that are working with us. So there's a lot that happens there. I've been fortunate enough to be a part of a lot of this work that is going on in Tennessee. And so I was on the committee who helped with the nursing apprenticeship program. So that was a great experience. And you think about what it can do for the workforce and also for students who are in school and who need some way to pay for school. School is not cheap. Nursing school is not cheap. And so having that opportunity to earn while they learn, that's the big thing, that they say about apprenticeships is, earning while you're learning. So that's great for the students, great for the employers, because if the students are training with them, then they will likely stay with them. So that's been just some of the work that can be done to help with workforce issues.
So I wonder, and I'm going to ask a totally separate question now. This is a roundtable on nurses and politics. I wonder what you think about whether policy literacy, but also political knowledge and awareness should be embedded into nursing education as a core competency. I mean, we all know that nursing education is full of so much stuff that we can't possibly include anything new. But I think this panel and everything we're discussing really puts into light why we need to start educating nurses beyond the bedside and thinking more globally. Can you talk a little bit about that?
Yes, it absolutely does need to be in there. It needs to be its own full separate competency, if you ask me. Because yeah, we teach patient advocacy, right? We're the first ones to advocate for our patients and speak up and make sure that they have what they need. But what does that look like for the community too? And just the United States, right? It has to go beyond the bedside. We can't just, because nurses work more places than just the bedside too. Our students have to come out of our programs really knowing how to engage in this process of political advocacy and understanding how things come to be. I think if we can, we all have state nurses associations, right? And most of them have days on the hills, so we've started with that as a thing for our students. But I mean, just think if all of us started taking students today on the Hill and really they could go and sit in on these different committees, they can talk to their legislators, they can know the process of reaching out. the most recent thing was what we're all been tasked with submitting comments, right? The comment period on our status as a professional degree program, so just we have to teach our students. They have to start early because we need to be making the decisions that impact us, the work that we do, and the people that we're taking care of. And the only way that they're going to be able to do that is if we start educating them on how to do that. It's a really scary process if you've never done it before, to go and try to connect with your legislator and talk about these different things, so really teaching them how you do it. What do you need to say? How do you even know who your representatives are, starting just from that. There's all these different apps, that different states have. All you got to do is put in your address and then it'll pull up for you all of your representatives. They need to know how to do all of that from start to finish and how the bills go through and everything. So yes, you got me on my soapbox here, but yeah, we need this in every single class. It needs to go through the whole curriculum of how it impacts all the care that they're providing.
You were invited for a reason.
Thank
Thank
you.
you. Gloria?
Yeah, the next question is for Dr. Mannion. What changes when nurses move from those advisory roles into now like decision-making positions like you're running for? And then how do risk and ethics shift policy framing, if you can share?
There we go. Uh, I'm going to start from the lens of not a political position, but a governance position. So, for example, with the Nurses on Boards Coalition, one of our beliefs is that every board should have a nurse on it. That's kind of fundamental to really good governance because nurses bring a lot of things to the table. And being in an advisory role, where you might be making a recommendation to a board, um, is a nice to have in terms of how the board perceives that. What we're driving in the Nurses on Boards Coalition is having a seat at the table and a voice at the table. And the seat is not just to be a placeholder and say, oh, we've put a nurse on this table, but that nurse has a voice and that nurse knows how to use that voice. And to that end, we've created a lot of competencies. So, Dr. Younge, your comment about competencies, the Nurses on Boards Coalition has spent a lot of time and effort developing board competencies that I think are very translatable into the political arena and around things like language. We have a whole module that we developed on language in the boardroom and how to talk in a different sense that makes your message really heard to people who are wielding power. So what changes when you go from an advisory board level, from an advisory position to a voting position is power. And it's all about power and influence. So if you want to make change in the world, you've got to have the power to do it. And we see the power of nursing in the fact that there's millions of us. And if we can unite around issues that matter to us, then we can make change happen. And I know that's Gloria's drive. It's the power of of the many that helps to drive the change. But it is being influential in a very different way when you are having a seat at the table and a voice at the table and you are voting on things that matter for your community. So, if you are taking that now, take that into Congress. Okay. So we know there are some very razor thin margins around some of the way that votes happen. And, everything is so exceptionally partisan right now. It's always, a shocker when someone from a party votes, with the other party because it's not considered the way to do business. But when nurses have the integrity and the accountability and the trust that the public has put on us, we bring those attributes to every decision that we make as a congressperson, as a board member. So we bring value. As one of my colleagues says, nurses are good for business. And I'm going to say that nurses are exceptionally good for politics because we get it. We know how to negotiate. We do that every day. We negotiate with our patients, like, please take your medicine. Like, how can we make you do your rehab? We negotiate with physicians. We negotiate with administrators. So we know how to get stuff done. And and Tariq, that's the tagline of our current governor. He uses a little less family-friendly version of that, but we get stuff done. We know how to make things happen. And that is where our power comes in. So, from a governance perspective, it is about having power, it is about yielding it for the greater good of our communities. I mean, all of the work that we're doing as nurses it should be done around our ethical framework. We have that ethical framework. We are advocates. We are compelled to be advocates. We are compelled to be a voice for those who have no voice, who are afraid to raise their voice. So, we have a job to do, and it's not just, being a clinician at the bedside. And I really loved what I heard about, shifting this dynamic in the academic environment and teaching nurses early on how to use their political power, because it's a tool. It's not a taboo subject. It's who we are. And if we don't use it for good, then we're not fulfilling really the fullness of what our nursing profession is really all about. So I'm going to stop at that point because I feel like I've said enough. But we really bring so much to the decision making that other people would never consider. But we have the lens of the human being, and we know what people need. And that's why we're good for this.
Thank you. Thank you, Dr. Mannion. I think you should put that on a shirt. Nurses are exceptionally good for politics. Dr. Leary?
Great. So, Dr. Ellison, can you talk a little bit about what you think would be accelerated in terms of reform if more nurses held office? Are there areas that you think, gosh, if only a nurse were in that position, or if only a nurse had written that policy?
Yes. And I think there's ways to divide this up too. I think we can talk about policy that affects nurses and nursing practice, and then policy that we all also know affects the patients to whom we provide care. So a big thing in Texas right now is full practice authority. It did not pass. And the reason it didn't pass is the advocacy groups down here are always having to play defense because the medical lobby is very, very strong in Texas. And one of the reasons why full practice authority didn't pass is because it was countered by the medical lobby. Now, if you think about, every physician I know is a member of his or her professional society, and those dues aren't cheap. And all of that money that goes to those dues pays for lobbyists. And Ann Richards said, who was a great governor in Texas, said, if you're not at the table, you're on the menu. Those lobbyists are at the table. Do you want to know how many nurses are members of Texas Nurses Association down here? It's like 5% of nurses are members of Texas Nurses Association. So imagine the how much fewer resources the lobby has when we're talking about things like full practice authority. And in terms of increasing access to healthcare, this is a numbers game, y'all. This is getting providers out there to open wide the doors of healthcare and having a mechanism to pay for it. So good physicians know that we need more nurse practitioners. We need them to be able to practice at the top of their license. They know that physician's assistants are helping physicians expand access to care, so that way our neighbors and community members can stay healthy or get better when they're sick. So I think that's one area, of advocacy that focuses directly on things like full practice authority for nurse practitioners, or like Representative Khan was talking about, staffing ratios, things of that nature. Also, too, Courtney, I wanted to talking about educating nurses on advocacy. I absolutely think we need to do that. But when you're working 12-hour shifts and you're taking care of 6 patients when you should be taking care of 4, and then on your days off, you're either trying to adjust to a day schedule, or you're doing other stuff, taking care of your family, it's hard to focus on advocacy. We need to not, run nurses ragged so they can feel good about what they're doing at work and still have energy to devote to these very, very important causes. Now, my big focus down here, the foundation of my campaign, what I keep running my mouth about, is Medicaid expansion, because I see firsthand in clinic what not having access to care does to people. Now, in Texas, we actually have a very small carve out for breast and cervical cancer Medicaid, where a woman, if she has a diagnosis of breast or cervical cancer, she can enroll in a Medicaid program. And what that means is you have your path report, you meet the income criteria and the citizenship or the residency criteria. The state of Texas takes care of your health care for about 90 days, and then it defaults into a managed care plan like an Aetna or a UHC Star, things like that. But the problem is women aren't having access to health care leading up to that breast cancer diagnosis. So I just saw a patient on, I can't remember, Tuesday this week, everything's a blur, recently in the last week. She felt a mass in her breast in May. And I've been in the field for 20 years. I still think healthcare is confusing to me sometimes, having to figure out how to find a doctor, what is covered, where do I go, what is a facility fee versus a provider fee, and so on and so forth. And I'm talking about people who often feel shy when approaching medical systems. They don't want to draw attention to themselves. 65% of the women to whom I provide care are Spanish speaking only. This woman felt a mass in May, was able to go to a free clinic, and then was told she'd have to pay $1,600 for a biopsy. This is someone who doesn't have a credit card. I mean, what are we talking about here? So by the time she gets to my clinic, 9 months later, after finally figuring out how to get a biopsy in December, I could look at her from across the room and tell you her cancer was at least stage 3. I'm praying it's not stage 4, but that's what we're figuring out right now. So Medicaid expansion would, at its foundation, allow people to have access to primary care. Now, there is one nurse in my state house right now. I can tell you, when our government leaders are making these policy decisions, there are not enough nurses in those rooms telling these stories. The patients are on the menu because no one is up there advocating for them in a way that resonates. There are no Democrat or Republican patients. There are only our friends and neighbors that are sick that need help. So I think when you have nurses in these spaces, I think I went on a tangent here and I'm trying to remember exactly, Marion, what the question was. But everyone I talk to that says, oh, good luck at getting Medicaid expanded, I think to myself, and you're the one advocating in the Capitol for Medicaid expansion, and you're telling me that it's never going to happen? Well, we need new people up in that state house. So,
and that was basically the question. Like,
okay.
how would things change if nurses were, were running the show?
I think we would put patients first. And if people keep saying, oh, we can't do it because reimbursement rates aren't great for providers and so on and so forth. I understand that reimbursement rates are not the best for Medicaid, but I also know that people are dying, and they are dying, or their treatment is far more expensive. I know all the facts and the data on how much it costs to treat a stage 4 breast cancer versus the stage 0 or stage 1 breast cancer. And we are wasting, people are dying, and we're also wasting. In Texas, uncompensated care costs are between and depending on where you look, $3 and $6 billion a year. Medicaid expansion would cost the state around $500 million. That's just math, but we don't have nurses at the table telling these patient stories. We don't have nurses talking about how the sausage is made in terms of very expensive treatments. So I'm waiting for nurses and teachers to take over.
Great. Thank you, Kimmy. Gloria, do you want to kick off our question section?
Yeah, so the chat has been on fire. Thank you so much for engaging there. I did want to just share that Dr. Justin Gill had to leave duty calls, but we'll now move into the audience questions. So we can begin I saw one from Julia Strimling. Did you want to share your question to see who would like to respond? Julia, if you could go off mute. If not, I could read your question. Julia Strimling?
Sure. I'm a nursing student in DC right now, and my question was, um, I've I'm leading a legislative action interest group and trying to get other students involved. So what's the best way to get students involved, like types of activities, but also how to approach them to like gain their engagement in these types of activities?
Yeah, from our panelists, whoever would like to take that.
Yeah, I can speak to it a little bit. I was also reading kind of some of the responses that you received in the chat. But I think if you can find something, some bill or some piece of legislation or anything that impacts them, and to present that to them and just have like an open discussion about the impact on it. I really find that just like me, unless it was impacting me, sometimes we don't tend to care that much or see the value in getting involved. But, Julia, if you can find something in some piece of legislation or something that is going on right now that is going to impact them and approach them from that aspect of it, I think you might at least get their attention, and then you can go from there like, okay, so how do we want to go about, making our voices heard on this? Do you guys want to come with me to the Capitol and or reach out to our representatives? Like, how can we tackle this together? But I think that's a start by just really trying to appeal to what is important to them and what is going to impact them.
Dr. McIntosh? Hi, Celia.
Hi. So thank you for that. I guess I was just sitting here thinking, and maybe this is for um, Tariq Khan, or anyone can really answer it, but I was just thinking about, the code of ethics here, and since our, nurse shift change is pretty much following that model, the HES principles, I'd love to hear about your role in the legislative process. When you're writing up and shaping policy, like what's guiding the decision-making framework. And basically, as nurses, how often do we look at the code when, how does the code inform that process? Because, even with thinking about things like AI, as nurses, we still have to follow our Nursing Practice Act in many ways. So I'm wondering, how does the Nursing Practice Act and the Code of Ethics inform that next layer of legislation policy forming?
I mean, I think it's sort of like these things are part of us, I think, as nurses. When you are in school, you sort of learn the techniques, you learn the principles, the values, and then when you're in the role of a nurse, you follow that. And so I think for me, it's been part of my journey as a nurse to live by those values, which is it's about the patient. It's patient-centered care. And for me, it's always about listening to my inner compass, my moral compass, and following what I believe is the right thing to do. And I think that is something that we do as nurses, and that's something that we should be doing as legislators. It's really listening to our instincts of what's right and what's wrong. And I think at a certain point, when those values are starting to be compromised. For example, when you're raising money and you have a goal, and then all of a sudden you get a check in the mail from CVS Health for $500, or you get a check in the mail from the hedge fund that bought the energy company from their PAC, and that's sitting in your mailbox. And it is that inner compass that you have to follow when if someone asks you to actually do something that is illegal, like they are asking for help with getting a grant, and they want to know where they can make the campaign donation to, and they offer you a certain amount. So it's listening to your compass, your inner moral compass. It's what we do as nurses, and I think so. It's not something that I go and sort of recheck the textbook and recheck what are the founding principles of our values as nurses, but those are important because it's something that we sort of learn, and that we reference early in our career. But I think as a nurse, I don't do that now. As a legislator, I don't do that. But I listen to um, uh, what has guided me throughout my career. It's that inner moral compass and making sure I'm doing the right thing and keeping it focused on the patients, keeping it focused on the people. And I think with that, and also too, I'll say too, which is linked, and I mentioned it before. I don't want to be a broken record, but really is our founding principles, the aspirational principles of life, liberty, and the pursuit of happiness. Really, what we fight for as legislators is ingrained in that founding document, the Declaration of Independence. We hold these truths to be self-evident that all men are created equal, common sense, equality, and they are endowed by their creator by inalienable rights of life, liberty, and the pursuit of happiness. It's all right there. I mean, I think it's the American dream, upward mobility, social justice, care for all, equality, equity. It's all there, and that is a strong guiding principle for me.
Thank you.
Thank you for the question, Dr. McIntosh. Any other questions? I'm just going to review the chat here. A big reminder again, May 7th is our rally. I hope to see all of you there. I think at one point we had up to 60 participants, so hopefully we see all 60 on May 7th. I don't see any other questions. Marion, we can go to the last question.
All right, so final round, keeping track of the time here. In one sentence, we're going to ask you all to tell us what you think one action is that nurses should take in the next 90 days to move towards political leadership. What can nurses do in the next 90 days to move towards political leadership in one sentence? And let's go with Courtney. Why don't you start us off?
Okay. I just had a feeling you were going to say Courtney first.
You're in my top left box.
Got it. Okay. To sum it all up, I would say find out who your representatives are and look at one thing, one piece of legislation that they have introduced or passed, or something that's to be discussed during this legislative session, and reach out. You can just send an email or you can call, but just take that step to, yes, I was gonna actually, thank you, Sharon. I was gonna mention the 5Calls app that you can download as well and use, but just, and in your state, okay, of course, I'm in Tennessee, so I can only say that we have Go Vote Tennessee app, which you put your address in and it finds, it lists all of your reps, but just find out who your reps are, look to see what they're doing, and contact them. That's the first initial steps to just getting involved. And I think that will put you on a good path towards just understanding and being in the space and learning how to navigate it so you can feel comfortable and build yourself up as an advocacy leader.
Great. Thank you, Courtney. Nancy.
Every seat in the United States Congress is up for reelection this year. So find candidates who support the legislative agenda that's important to you and support those candidates. For every nurse that's running in a local election, you need to support them. That I think these are the kinds of things that are going to make a difference. If we want to see ourselves in seats of power, then let's put people who are us in those seats of power. So that's what this is not a time to be a spectator in American politics. I think that there's way too much at stake, especially with healthcare really in the crosshairs. And our government just really failing to understand how much the fragility of the healthcare system is at risk and what that's going to mean for all of us. This is not a time to be a spectator. So it's an action time. So get involved, support candidates that are a nurse or support nurses, but don't sit back.
Thank you, Nancy. And that I'll plug Healing Politics one more time. If you are all so inspired by tonight and thinking about whether you should take that leap, check out Healing Politics. They have a campaign school coming up this summer. Kimmy, your one sentence for an action?
Well, primary election day here is on Tuesday, so I would say anyone in Texas, you have to vote. Also, too, it's going to be a sentence with semicolons. Vote, Healing Politics, consider enrolling in a campaign class like Healing Politics. I did New Politics. Reach out to your local advocacy group like Texas Nurses Association or some other state association with whom you feel aligned and get involved. They will have legislative updates. They will have meetings for you to go to. They will have lobbying days for you to participate in. Or local, whatever your political persuasion is, get involved in your local party. That's sometimes functional, sometimes not functional, but it's a way to dip your toe in and to become more involved. But for sure, we got to vote. You got to ask people, how was your weekend? Did you vote? Like, it's got to become that common.
Great. Thank you, Kimmy. Tarek, close us out.
So what I would say is what I tell people when they were asking me how they could show up in this moment. And what I tell them is that be awesome at what you do best. So if you're someone that is really good at writing op-eds, write an op-ed. If you're someone that's really good at raising money or are able to donate money to a candidate that you support, do that. If you're someone that's really good at knocking doors and talking to people, do that. If you're good at registering voters, do that. If you're really good at getting involved in the advocacy of your organization, like nursing organization, like your state nursing organization, do that. But do what you are comfortable doing. We're not all able to be in the streets, fist in the air. We're not all able to do that, right? But sometimes we can. So whatever it is that you can do to be awesome in this moment, and you do it in your jobs every day when you're advocating for patients, do that and show up. And also talk to people. Talk to people that you don't agree with. We do it all the time as nurses. We do it every time. We treat people no matter whether they agree with us on policy or not. We treat them the same. There is no difference in politics. Listen to everyone, be humble, and have conversations, because that's the only way we change our politics is by having those conversations.
Great. Thank you all. Gloria, do you want to close out this incredible roundtable?
Yes, thank you. A sincere thank you to all of our panelists. We heard it. Nursing is political. Governance is not outside of our lane. It really is written in our code of ethics. And if we understand the upstream determinants of health, then we belong upstream in that power. So this is not ambition. It is our responsibility. Let's own it. I will see you all in DC on May 7th. Thank you and good night. Bye-bye.
Courtney, I'm so sorry. And you know what? I just donated myself. I'm so sorry. I will spread the word.
It's okay. Thank you.
I was kind of multitasking, or I would have done everybody, but I know Susie told me to support Susie Hassmiller. So I've been trying to do that, but I'm
We
donating right
we
this
can
minute.
we
And
can
good
post
luck.
after, Sharon. That works too, right?
Okay, I did post
Yeah.
it, but
Oh, good.
so hopefully it will get out there. But I think
Yeah.
you're doing amazing work. So happy to support.
Yeah, thank you. Thank you.
Have a good evening.
You
Thank
all
you.
too.
Good night, everyone. Bye-bye.
Bye.